Ever wondered what happens when your body is overloaded with potassium? It's a condition called hyperkalemia. Now let's break it down. Hyperkalemia is a medical term that describes a potassium level in your blood that's higher than normal. Potassium, a nutrient that's crucial for heart function and muscle contraction, can pose risks when its levels surge. Imagine a party where the guest list got out of hand. That's your body with too much potassium. It can cause irregular heartbeats and even sudden heart-related emergencies. In the spectrum of hyperkalemia, there are different stages, each with its own set of symptoms and complications. Think of it as a ladder, with each rung representing a new stage of severity, but we'll get into the nitty-gritty of these stages in the next scene. Understanding hyperkalemia and its stages is important, especially if you're in the medical field or studying to be. So, stay tuned as we delve further into this intriguing topic. Diving right in, hyperkalemia has three main stages: mild, moderate, and severe. Mild hyperkalemia is the initial stage. Here, potassium levels in the blood are slightly elevated, typically between 5 to 5.5 milliequivalents per liter. Symptoms at this stage are usually nonspecific and may even go unnoticed. They can include minor muscle weakness or fatigue and sometimes slight palpitations. Moving on to moderate hyperkalemia. In this stage, potassium levels range from 5.5 to 6.5 milliequivalents per liter. Symptoms become more pronounced, with patients experiencing muscle discomfort, numbness, or tingling sensations. There could also be irregularities in heart rhythms, often recognized as palpitations. Finally, we come to severe hyperkalemia. This is where things get critical. Potassium levels exceed 6.5 milliequivalents per liter. Symptoms are severe and can lead to life-threatening complications. Patients may experience significant muscle weakness or paralysis, difficulty in breathing, and pronounced irregular heart rhythms. In some cases, it could even lead to cardiac arrest. Understanding these stages is not only vital for diagnosis, but also for treatment and management. Mild to moderate hyperkalemia can often be managed with dietary changes and medication adjustments. However, severe hyperkalemia is a medical emergency that requires immediate treatment. Each stage of hyperkalemia presents its own set of challenges, and it's crucial to recognize them early on. Now you're probably wondering, how does hyperkalemia affect the heart? Well, it's all visible on an ECG. Hyperkalemia, or high potassium levels in the blood, can significantly affect the heart rhythm, and these changes are readily apparent on an electrocardiogram or ECG. In the early stages of hyperkalemia, you'll typically see tall, peaked T waves. As the condition advances, the PR interval may prolong, and the P wave might flatten or disappear entirely. When potassium levels continue to rise, the QRS complex, which represents ventricular depolarization, starts to widen. If left unchecked, this could progress into a sine wave pattern, which is a serious, life-threatening situation. In severe cases, you might see a blockage of electrical impulses leading to a slow, irregular heart rhythm or even cardiac arrest. Understanding the correlation between hyperkalemia and these ECG changes is crucial. Recognizing these changes early on can help initiate prompt treatment and potentially save lives. So, recognizing ECG changes can be a lifesaver when dealing with hyperkalemia. So, what should you remember about hyperkalemia? Hyperkalemia is an elevated level of potassium in the blood, which can progress through various stages and manifest distinct changes on an ECG. It's crucial to recognize these signs early: the peaked T waves, the widened QRS complexes, and the sine wave patterns, as hyperkalemia can be life-threatening if left untreated. Remember, understanding hyperkalemia can make a big difference in patient outcomes. So keep learning and stay curious.